Welcome, folks. Welcome. I am hopefully welcoming you to the last HSS virtual showcase. I am really crossing my fingers that this is the last time I see us in this particular way. It is painful, but yet joyous, and it is lovely to see folks. I really appreciate you joining us on a hot Thursday afternoon without us feeding you. So that is no small thing. Usually it requires, at least for me, the only way Christina gets me to go is to promise me crab cakes or something sweet. So I owe you. So thank you. Let me get started here. But before I do, I want to really give a shout out. And so look for your reaction buttons here. Okay. So I want to give a shout out to Susan and Nicole and John for really just shepherding us as they always do. Thank you. All right, let me get started. And I've got some opening comments, right? Let's see here. All right, let's get started. Before we pop into this, many of you know, this last week was hard with the passing of a dear friend, dear colleague, a mentor, an advocate, a huge ball of energy. And with the passing of Nina, we're just a little bit lost. And I want to take a moment to acknowledge her. And also, you know, since we've last met as a community, to acknowledge the pain and the suffering and the atrocities that are going on in Ukraine, and how that has affected millions of people, millions of families across the world. And if we could just really, if you would join me in taking a moment of silence and respect and reflection for both Nina's passing as well as Ukraine, that would be lovely. All right. So, you know, the title of the showcase is Community Wellness and Healing in Times of Uncertainty and Injustice. And as you can see, this does continue to be a time of pain. This does continue to be a time of loss and struggle, and most certainly about uncertainty, right? So I think this showcase today and the words of our colleagues to follow are going to be much needed and very much a timely one. But equally important, you know, the title of today is also honest, because it's honest about the uncertainty. It's honest about the continued injustice. It's honest about the challenges of change. And when we're really asked to speak about community and collective wellness, it's honest about the exhaustion many of us feel in the face of chronic injustice, right? And so I'm really reminded of my mentor in college, who always, you know, every time I hugged him and left him or we exchanged emails, he'd always talk about, you know, keep on keeping on and how to keep the faith. And I think this is kind of the spirit of what we're talking here today. So I wanted to share with you a few slides. This framework for a model of radical healing, and it takes a riff off of Sean Ginwright's. And I wanted to share this model with you. It's a model that some of my dear friends have passed along. And shameless plug, I also like it because my partner was one of the authors of this model. So it is definitely close in my household. And I won't go all into the details here, but I just wanted to share with some specific elements. At the end of my presentation, I'll actually drop the article in the chat. Feel free to look it over in more depth, but this gives you a visual representation, right, of a particular model. So. But when we talk about community wellness, and when we talk about taking care of yourself, you know, a lot of the images that pop up in that notion of self-care, you know, things like taking a vacation or exercising more or eating better or, you know, going on a hike, right? And what I love about the radical healing framework and what I love about this particular showcase today is its emphasis on community, the emphasis on community, because wellness and healing isn't only something that's done individually, nor is it just something that's designed for individuals, but there's something to be said about the wellness of a community, right? And the healing that comes from coming together, the healing that comes from joining together and connecting with each other. And so the focus today on wellness and healing is really a collective one, right? And this is really the spirit of how we began doing these showcases to begin with, because we've been so stuck in different silos in our different departments. We have our heads to the grindstone. We're focused in one particular slice of the world. And even now, more so, particularly with the pandemic and the quarantine, and you know, we've been so dispersed. And so there is a gift, there is a healing that comes from coming together, right? And when we think about the need for community in the face of injustice, that's even more so. Because when we think about, and we have talked plenty in this space about how injustice and oppression are so entrenched, how assumptions are so embedded, how policies and practices have just become normal and as is. Right? To face that all alone, to change that all alone, to give voice and name that all alone, it's not doable. It's not sustainable, not to do it alone. And so the need for community is really, really clear. And I want to share with you a story that honestly, I didn't know I'd be talking about today. And a few days ago, we met for the College Council, and that was Tuesday. And we sat down together, and usually there's a meeting there where we select the undergraduate and graduate hood. That's what we do. We've been doing it for years. 4 departments came to the table, and they wanted to talk about 4 students they'd identified for the undergraduate hood. 6 departments came together to talk about the graduate hood. Each chair shared their stories about their respective students. We went around on Zoom. We talked about their GPAs. They talked about their academic success. They talked about, you know, the life stories, the barriers, the challenges, and many times the trauma that each of these individuals had overcome. We talked about the impact that each of these students, these fantastic students, were trying to have in their departments, in their communities, with their families, you know, with their peers. And it was heart-wrenching, as it always is. And it was difficult because each of these stories were so profound. Each of these stories were so powerful. But the heart-wrenching part was that the university process was that we needed to pick one. We needed to pick one out of the 4 undergraduates. We needed to pick one out of the 6 graduate hoods. So we did that. We, Susan helped us. We had a little Google form. We put in our votes. We put in our names. She tallied everything. The votes were in. It's the same thing that we have been doing in this college for 20 some plus 25 or so years. It's the same thing I've been a part of for the last 11 years. And we're continuing business as usual to pick one hood, one for graduate, one for undergraduate. Until one chair, who will go nameless, but is probably somewhere in the criminal justice studies department, stopped us a second, just asked us to pause a sec, and to reflect. And we talked a little bit, began a discussion to think about how this process of selecting one individual, how it perpetuates a sense of competition, how it perpetuates and elevates individual achievement, how it perpetuates this hierarchy of who is better and who is not, who is worthy and who is not. And in short, it began to really hit us about how much that this perpetuates a set of values that are so contradictory to what we try to teach our students, right? And Marty really named it and said, and observed how so many of these students have devoted their entire lives to challenging systems and to making systems better. Yet here we are, the leadership of this college, myself included, are essentially perpetuating a system of hierarchies, a system of competition, a system of individualism. And I raise this story because this really underscores for me the need for a collective when we face injustice, for a community when we face injustice. Because see, the most insidious part of oppression is when it becomes mundane. Let me say that again. The most insidious part of oppression is when it becomes mundane, when it becomes so normal that it passes through our day-to-day lives as if that's the way it always needs to be. And there's that saying, like, the greatest trick the devil ever pulled was convincing the world he didn't exist, right? That's how oppression continues, right? That's how hierarchies continues. And so we need and value a collective to come together, as this picture shows, to have those discussions with like-minded values, with like-minded aspirations, to begin to question the air around us, the air that we breathe and the air that we've been doing. And so, the radical healing framework then talks about envisioning. And the way I look at it is creating. And one of the things that I have enjoyed the most about coming together is also the creative part. So the group of chairs and myself, we began a discussion about, okay, well, now that we're naming it, what do we do? What is it that we're creating? And, do we just honor one student or two students or all of them and stuff? And what we decided to do was we decided to submit all the names as a group. And it was our attempt to interrupt and to interrogate and to critique the process, to honor the collective rather than the individual, to focus on honoring, right, rather than competition, and to interrogate and undermine the value that we often have in academia, the value that we place on hierarchy of better than or less than, which, when you think about it, that hierarchy of human value is exactly what oppression is all about. Somebody's better than or less than. So as we ended our discussion on these hood recipients, I asked the group to draft a statement, a rationale that I would present to the provost. and nothing long. And I will also drop that after I do my presentation. I can't do all the things together. I will share with you the statement that we had written. And I've already sent that forward to the provost. She's received it. I've presented it to the group of deans so they know what we're talking about, what we're thinking about. I'm very pleased to say that the first dean to respond to me was a dean who will not be a dean very much longer, Dean Tsuyoshi, who expressed her full support for the ideas that the chairs had put together, right? So I will share that with you. So, you know, it's not easy to name what is invisible, right? While this particular group of chairs, you know, did this in this amazing amount of time, in less than 24 hours, we had a beautiful statement. Again, I will share this with you at the end. And they did it lickety split, and we came to consensus. We came to heart. There was, you know, this feeling of creativity, of joy, of possibility, I think, in the room. And I was proud of them. And, you know, what it struck me though is that I've been doing this same process for 11 years of selecting one undergraduate, selecting one graduate. I've had maybe about 30 different chairs that I've worked with in this room. And guess what? This was the first time we'd ever called the process. So this process of naming what's individual takes work, right? Just like in this slide shows. And I was speaking to the former dean, Don Taylor, the other day, and what I said to him was like, you know, it's one thing to walk a path. It is an entirely different thing to create a path, right? It is an entirely different thing to create a path. Right? And the process, right, and of creating something that never existed is exhausting, it's tiring. And yet that is exactly what we are called to create ideas or processes that have never existed, right? Give you another example. The Race Collective, as you know, has put out a call for an assistant dean of restorative and transformative racial justice. That's a long name for an administrator. But I can tell you, it took us the time to pick exactly those words, to pick the job, create a job description for that individual, right? To really create something. Why? Because it's not like there was another PD on this campus for an assistant dean for restorative and transformative racial justice. That's not exactly something you can Google, right? And so this is the work of creating, as you see on this slide. And it makes sense because creating justice, creating something that hasn't existed, right, is painstaking, it's laborious. Yet that is exactly what we need to do. And my last slide here really says that this process of creating, I think also brings healing. It also brings, you know, there's a lot of attention right now, and I'm tired of it, about being an anti-racist. I'm done with that term. I'm done with that term. Because it doesn't name what I'm striving for. It only names what I'm fighting against. And I'm tired of that. I'm tired of simply fighting against things. I'm tired of simply naming things and calling it out. I'm tired or unable to do that alone. And what I need for my own wellness is to create a space like the one we've created today, to envision things that haven't existed, to come together with others like you all to dream, right? And we've done that. In creating this statement about how to interrogate how we select hoods, we are dreaming. In creating an assistant dean for restorative and transformative racial justice, we are dreaming, right? We've created a group to really look at tenure and promotion in the college and integrate social justice into that from its foundations. That is dreaming. Right? In creating this space today, we are dreaming. So in closing, let me step aside so that you can hear from some of the other dreamers in this college who can give us a peek, a view, just like this individual is doing. So where does this path lead us? Where does the path of creating take us? And hopefully today you can find some healing from today's presentations. So with that, let me turn it over. I want to, before I want to invite Mickey Eliason, and I've been given a little bit of a bio here, and I want to just read a little bit. And Mickey has been our assistant dean for faculty development since 2015. She's been in the Department of Public Health since 2007, and her background is in nursing and psychology. Her research interests are primarily in the area of LGBTQ health. In 2013, she was awarded a Lifetime Achievement Award for her body of work by the National Advocacy Group, GLMA, Health Professionals Advancing LGBT Equality. She has written extensively about these topics and is the primary author of LGBTQ Cultures, What Healthcare Professionals Need to Know About Sexual and Gender Diversity. Her background and doctorate are in pediatric and educational psychology from the University of Iowa. And I think this is the most formal presentation I've ever given to somebody I just cherish as Mickey, as you all know her. So Mickey, let me step aside here and give you some space.
Thank you, Alvin. I wanted to have this opportunity to address this body for one last time before I retire, so indulge me in a little research presentation. Today, I'd like to share cutting-edge research on the COVID pandemic as we learn to cope with social isolation and disrupted work routines. I spent 2 years in ethnographic study of one aspect of contemporary pandemic life, the Zoom meeting. I was a participant observer in over 1,500 work-related Zoom meetings. Data analysis was driven by a new methodology created specifically for the field of pandemic studies, languishing on the sofa immediately after a meeting to process the experience. I'm going to discuss 6 themes that emerged from this languishing method. The first theme was increased self-consciousness and body self-esteem issues. Unlike general body dissatisfaction disorders that focus on weight and body size, Zoom self-consciousness centers mostly on the head and neck. Until Zoom, we were blissfully ignorant of what we looked like in meetings. Zoom is akin to staring into the mirror for prolonged periods of time, something that most of us assiduously avoid. So this prompted thoughts such as, when did I get jowls? What happened to my neck? Are my glasses always that lopsided? Is that dandruff on my shoulder or dust on my screen? Underscoring the seriousness of this self-consciousness, there's been a meteoric rise in Googling facelift estimates and an increase in Amazon orders for wrinkle creams. Theme number 2 was the uncanny resemblance of Zoom meetings to seances. People appear suddenly out of nowhere in small boxes on the screen, sometimes as shadowy figures in dimly lit rooms. Common questions include, is anyone out there? I can hear you, but I can't see you. Can someone send a message to Shirley to ask if she'll join us? Many Zoom meetings are haunted by poltergeists who make the internet unstable at inopportune moments or cause people's arms or the top of their heads to appear and disappear. These gremlins will also ensure that when one's face freezes, as it inevitably will do, it will be in the most unflattering expression possible. So I recommend you burn sage, smudge, or say an incantation to soothe the spirits of cyberspace before clicking on the Zoom link. Zoom backgrounds make up the third theme. Prominent researchers are developing tests of psychopathology based on one's choice of backgrounds. For example, data shows that people who have a sparse, tastefully decorated bookshelf with a curated selection of art and books may represent potential Anna Delveys, that is, people who are faking being smarter, more sophisticated, and more organized than they actually are. Their neat and tidy bookshelves may also create shame in other participants who feel inferior because of their messier workplaces. Other people may choose whimsical backgrounds. If your coworker seems to be sitting at the kitchen table with the Golden Girls, this person may be binge watching too much oldies TV. A Freudian analysis of the symbols and backgrounds reveals much about personality. For example, be aware of the colleague who has the Salesforce tower as a Zoom background. Some people use their real backgrounds to taunt others. They allow their cats to walk across the keyboards multiple times during a meeting, and worse, they flaunt their dislike of other people passive-aggressively by forcing other Zoom participants to look at their cat's butthole for minutes at a time. The fourth theme addresses Zoom etiquette. Inappropriate behaviors include eating potato chips from the bag without muting, taking one's device to the bathroom without muting, actually doing anything without muting. And then there's the stress of not being able to locate the leave meeting button and finding oneself alone on the screen with the boss. Some participants' faces will appear right in the middle of a speaker's impassioned presentation because they forgot to mute and cleared their throats. These kinds of interruptions can lead to long periods of such stimulating conversation as, "I'm sorry, you go." No, you go ahead." "No, what were you saying? You cut out for a minute. Can you repeat that?" Zoom has created a new social anxiety disorder, not knowing when a meeting is over. Is it during or after the prolonged goodbyes? Is it offensive to leave the meeting before the last person has said goodbye? No one knows. The fifth theme is related to muting. The most common comment in every Zoom meeting I observed was, "You're muted." Not muting your mic has become the new reply all. Muting anxiety disorder is characterized by a lack of confidence in one's ability to unmute fast enough. This person may get an involuntary tremor in their hand from hovering over the unmute button for the duration of a meeting. But this must be differentiated from Zoom dementia, a condition that has many variations. For example, staring at one's own face for hours may lead to the obsessive thought that others are staring at you and judging your appearance. This is called narconoia. It's at the intersection of narcissism and paranoia. Another form of Zoom dementia is loss of memory for the Zoom functions, so that you only find and click on the applause or the heart reaction 5 minutes after a coworker has said something brilliant or touching. Another theme is related to use of the camera. Zoom etiquette dictates turning on the camera at minimum for 30 seconds at the beginning and ending of a meeting, so coworkers know that it was actually you rather than a test dummy or your pet sitting in your seat. Like on many dating sites, some people select profile pictures of themselves from 20 years ago, perhaps in a ploy to offset those reminders of aging caused by staring at oneself on Zoom. For those people who have no profile picture, just an empty box, this may be a sign of an existential crisis, and someone should reach out and check on this person. Many people feel anxiety about turning off their cameras during a meeting. This may be much like getting food from a buffet line at a work reception or our previous showcases. No one wants to be the first, and you definitely don't want to be the only one. Zoom chat disorders are similar to misuses of email. Some people inappropriately use the chat to convey unrelated information or send sarcastic comments meant only for their friends, but to everyone on the call, much like the reply all fiasco of email. Inability to focus on what is being said in a meeting because of the side conversations in the chat is another warning sign of Zoom dementia. People who dominate conversations in real life may use the chat to post long diatribes to subvert the message of whoever is currently speaking. Finally, power struggles among coworkers manifest differently in Zoom meetings than when face-to-face. So if the host of the meeting has control issues, they may be slow to admit people from the waiting room or to share the screen, and they may mute people they don't like when they're talking. Others who are attention seekers may deliberately not mute their microphones and constantly tap a pen on their desk to keep the camera on them. But those who deliberately mute the boss while the boss is speaking may be fired for mutiny. With some explicit discussion of Zoom etiquette at the beginning of each semester, most of the issues that I've raised here could be eradicated or reduced, improving the mental health of everyone who uses the technology. So in conclusion, I've tried to shed some light on the psychology of Zoom communications. But if this presentation wasn't even remotely clear, please let me know in the chat. And I also want to thank you for the honor and privilege of serving as Assistant Dean for the past 6 years. I've really enjoyed getting to know so many of you and to know I have such incredibly talented and dedicated colleagues. I wish you all the best in your future careers. And I hope that you'll stay in touch. I'll be keeping my same email, and I'll even have a Zoom chat with you if you promise to follow the protocols. But now let's get back to the program, and I'd like to introduce the moderator for today's powerful panel. So Gretchen George is an associate professor and program lead of nutrition and dietetics in the Family Interiors, Nutrition, and Apparel Department. She's passionate about prevention and empowerment. She facilitates learning through nutrition education, metabolism, community nutrition, and research courses. And she includes students in her food literacy and basic needs research that's focused on community and the college student. She also explores weight stigma and health-related majors from a social justice perspective, with an overall goal of eliminating weight bias in health professionals. Another of her goals is to strengthen the understanding of what health means, connecting individual, trauma, access, environment, and biological mechanisms to dispel stigmatizing false information. In her free time, which I'm not sure how she has any, Gretchen lectures for Stanford Healthy Living Be Well program and enjoys hiking and traveling with her family. So the floor is yours, Gretchen.
There's that.
I'm going to step in here before we lose thread and you take the floor. Can we all see what would happen if we were in person? We would hear the applause.
Yes.
Right? Could we all please unmic so we could give Mickey that gift?
Thank you, Mickey.
Thank you, Mickey.
Thank you.
Thank you, Mickey.
That was amazing.
Amazing.
And Mickey, you can't see us, but we all actually stood up and gave you a standing ovation. So anyway, Mickey, you are loved, you are cherished. You're everything we could have wished for and needed. So thank you so very, very much. Really, truly. I will leave it to each of us to connect with Mickey in our own different ways and to express that. And Mickey, I just wish we were together and I could give you a hug. Enough said. All right.
Thank you.
Because you skittered to Gretchen too damn quick, I couldn't get to my unmute button. So I had, what is that anxiety thing you were talking about? So
Mutiny. Right?
yeah. Oh yeah. Yeah. Okay. All you, Gretchen.
Yes, Mickey, thank you. That presentation was fantastic. I feel like I am living all of that right now, all of those shared themes. And your career, thank you for devoting so much time to all of us. You've definitely mentored me in my journey to tenure. I had you read my statements and you gave me so much great feedback. And that booklet you made is like my Bible as RTP chair currently. So we will miss you. I kind of want to say, can you stay a little longer? But thank you. And thank you, Alvin. You always kick off these events so inspirationally. I wrote down what you said, just like, instead of fighting against, let's strive, let's dream, let's create that path, you know, with and within our communities. And I think that's a perfect way to like connect into what we're going to talk about today. As Mickey said, I am in FINA and I see some FINA family members out there because we are a happy little department. I actually was thinking back, I've been lecturing here on and off since about 2004. And honestly, every day I learn something, every month, every year, and apparently every decade. So I'm looking forward to one day when I can say, later I'm retiring too, and just imagining how much I'll have grown by then. I also feel extremely grateful to be here with all of you, right? For the Community Wellness in Times of Uncertainty and Social Injustice panel. The present day is collectively traumatizing and exhausting. That said, personal and lived experiences are changing us uniquely. And all of this uniqueness, impacts us personally, professionally, in everything we're doing. To me, in my day in and day out, work, personal, it's just so clear that we need support. We need to support each other collectively and then also uniquely. And that takes time and it takes patience. We're here today because of all of you, right? All of you are devoted to helping others. Many of you in the audience describe yourself as mentors, as teachers, as advocates, scholars, allies. There's probably parents in the room, there's caregivers, and definitely a lot of friends and colleagues. But the truth is we wear these hats simultaneously. I have 2 young children right now, and I definitely feel it. I feel all these hats and they're really heavy. They're beautiful, but they're heavy and they're complex. All of us have had to pivot, pivot daily. I'm pivoting right now. It's my kids' spring break. It's a pivot. So all of us, we're pivoting and we're learning to move in different ways, and we're watching how others are doing it. And, we're relearning. We're relearning how to exist and thrive in the ever existing unprecedented events. I did just get a banner that we have a new Supreme Justice, which is some good news, juxtaposed to probably Ukrainian stuff. I just found out today my dad has COVID. So there's lots of stuff that hits us right and left. Bringing it back to all of you, in your work, you continue to watch and engage with communities. Many of these communities struggle. And as we know, even more so now that the pandemic has widened existing inequities. People aren't able to access fresh food, basic needs, all sorts of things. We all see this in our classroom, in our student bodies, that these new ways of learning, while they seem modern and niche a few years ago, are now rattling us, as Nikki said, self-confidence, belonging, social connection, self-perception, visual dysmorphia. You yourselves are probably experiencing this, and the community leaders who you're working with to train our future students. It's unthinkable and it's predictable, these shifts that are happening. There's been some good, right? We've really pulled the Band-Aid off of a lot of things. And then lots of bad things are rising. But as change happens, and these uncertainties continue on, hopefully the needle will move towards growth. And that brings us to today, right? In thinking about the meaning of today's panel, I was revisiting, as Alvin brought in that word community. I was, Googling definition of community. What do I think community is? And I was thinking about actually in a class that I teach in spring. I have a course bio, yes. So I'm not teaching it this spring, but I was reminded of what I do to start it off. So in this class, it's community nutrition. Actually, Dr. Kumar Zubeda on here is teaching it this semester. And we teach the students about nutrition needs, about guidelines, about programs. They get out into the community and they conduct needs assessments. They walk around, or they virtually walk around. They talk with people, they read, they learn, they ask. And most importantly, they listen, or we tell them to listen or encourage them to listen. Really the goal of this assignment and this project is, to devise interventions or awareness campaigns with the community to help the community. And what we do, we start off the semester asking them a question. What does community mean to you? And whether we're physically together, I used to turn the desks around, right? Or virtually, I'm like, please turn your camera on. And we face each other and we listen. And always what stands out to me the most about that experience is just watching their faces, like watching their face as some of them will, by the book, define community, and other people will have these very unique and personalized definitions. And as they hear and think about these new rich visualizations, this feeling of fellowship emerges. And I love it. It like gives me the chills just thinking about it right now. And that's what made me think about us today, is that in this process of sharing, a community is created. And so building upon what Alvin was saying is that we need to strive, right? We need to dream, and we can do that, right, in the process of sharing and working together as a community. And I saw that when I met with the panelists last week and listened to them speak and share and talk about what was going to happen today. I really saw them connecting. Ruby, Julie, Stephanie, they do work that embodies community wellness and leaps towards health equity. Their work illuminates in the classroom and in the community, and they work to ensure that others have fair and just opportunities to be as healthy as possible. Their work focuses on removing obstacles or highlighting obstacles to then remove them in the future related to stress, mental health, the trauma of racism and racial injustices, with the hope for new and continued healing that comes from culture, humility, empowerment, education, transparency, and community. On that note, let me introduce these fantastic humans. I have had so much fun reading all about them on the internet and learning about them. But let's start off with Dr. Julie Chronister, and she is a professor in the Department of Counseling at San Francisco State. She's a faculty member in the Clinical Mental Health Counseling Program. She's a committed teacher, scholar, and advocate who's published over 50 peer-reviewed articles. Nice work, book chapters and books. Dr. Chronister has also received funding from the National Institute of Mental Health to conduct research in the area of social support and serious mental illness. And she's been awarded training grants from the RSA to provide scholarships for her students. She is very committed to improving the lives of the most marginalized and stigmatized communities through her research, teaching, and community partnerships. Just a little bit of background, maybe some of you will be connected this way, but Dr. Chronister received her PhD from the University of Wisconsin, Madison in 2004, and she's been writing and conducting research in the area of social support, coping, caregiving, serious mental illness, and disability for over a decade. She's also a co-editor of the book, Understanding Psychosocial Adjustment to Chronic Illness and Disability, and serves on the editorial board of several top-tier peer-reviewed journals. She recently received a behavioral health workforce grant from the Department of Health and Human Services for the project entitled Equity and Justice Focused Integrated Behavioral Health Counselor Training Project. And she is the principal investigator of this. The project does aim to increase the supply of counselors trained to work in integrated behavioral health settings from an equity and justice focused orientation. A primary aim of this project is to strengthen the relationships with community health centers that provide these services to our most underserved communities, including communities of color, and also communities that have been harmed by our healthcare system, which we know are many. So let's unmute and give Julie some clapping. I'll clap. Yay!
Thank you.
Taking it back to summer camp. A round of applause. Next, our second panelist is Ruby Turalba, and she has her Master's of Public Health from San Francisco State, and she is a lecturer in the Department of Public Health. Ruby is also a child of immigrants from La Union, Philippines. She's an educator, ally, and mentor who describes herself as a scholar practitioner working for community health and justice. She's been teaching public health at San Francisco State since 2010. And her teaching practices integrate cultural humility, liberation education, personal narratives to explore social and health inequities. Ruby has served 2,000 plus undergrads, which this number just made me pause. Many of these are low income, immigrant, and first generation college students of color. She regularly infuses class time with health and wellness, self-reflexivity, and relationship building. Previously, she worked in tobacco prevention in the school, in the community and health departments, and now she's working on a project that she'll share with us today that just focuses on the development of student self-confidence, positive identity, and the sense of belonging. In her free time, right, as we all laugh, free time, what free time? But she's actually pursuing an educational doctorate. So she's just, in her free time. And she's also a research consultant for the South of Market Community Action Network, a nonprofit serving Filipinos in San Francisco. So let's unmute and give Ruby a round of applause.
Woo, Ruby.
Yay, Ruby.
Yay, Ruby. And our third panelist is Stephanie Windell, and she is an assistant professor in the School of Nursing at San Francisco State. She received her Doctor of Nursing practice degree from the University of San Francisco, her MSN and BSN from the University of Wisconsin. You see some connections here. And she actually teaches psychiatric mental health nursing and integrates holistic health content and healing practices into the curriculum. Her specific research focus is on teaching guided imagery and undergraduate nursing education, and teaches stress management skills to nurses and nursing students. she teaches guided imagery and relaxation techniques in San Francisco State Skill Lab, actually. And this gives students a chance to both experience and provide those practices, which is so important, experiential learning. Stephanie chairs the School of Nursing Success and Wellness Committee, and she provides brief stress management tips in the weekly School of Nursing newsletter. We're hoping she'll give us some tips today about stress management tips, right? And the last thing that I really found so fascinating was just that Stephanie works with horses and has an equine therapy practice that harnesses the power of horses for healing, growth, and insight, which is fascinating. Honestly, from learning about what they do, I'm inspired. I'm like, woohoo, I can't wait to hear from them today. And I hope you are feeling inspired and hopeful as well. So before we start with our question, I'm just gonna allow each one of the panelists to just take a moment and say hello and just have a short personal introduction, so then we can humanize it before we get started. So who wants to go first? Julie. You can go alphabetically. How about you, Julie?
I'm going to say up front, my glasses just broke. So if I look like I'm just squinting, I mean, I'm trying to find a pair that works, but it's not happening. But any event, thank you so much for that lovely introduction. I am so honored and touched and humbled to be here with all these amazing colleagues. And a little bit about me, she, her pronouns. I'm from Central Illinois, but I haven't been there in a long time. Spent some time in New York at Hunter College, but I am a California person now. I've been here since 2007. I have a 15-year-old son who is right on target with not talking to me at all. And I have a dog that's getting old, and I never thought I'd be obsessed about my dog, but yet I am. And what else can I tell you? I think that's about it right now, other than I'm just really honored to be here.
Thank you. Is your dog right next to you? Is my question for you.
Yeah.
Yes, okay.
Of course. Right behind me, warming
Oh.
up my back.
So sweet. All right, Ruby, would you like to share?
Yeah, my finger was sitting on the mute button. So thanks again for the introductions. Thanks for all the woohoos and applause. It helps, right? For someone who is super excited and super nervous. But I am so excited to be here today alongside Julie, Stephanie, as well as you, Gretchen, to really lift up the community health and wellness work that I've been doing. I'm not going to talk about my student wellness project, but I will talk about the project that I've been working on with the Filipino community downtown. My name's Ruby. My preferred pronouns are she, her. I live and work on the unceded territory of the Ramaytush Ohlone tribe. And something that I've learned from disability justice is that physical descriptions are important, especially in this Zoom platform. So I am a Filipino woman with medium brown complexion. My hair is shoulder length and black, but in the last 2 years, there's a lot more silver. And I'm wearing a blue blouse. I also have 2 kids. I have a 16-year-old who has her driver's license, so she's driving me around. And I have a 13-year-old son whose track meet I will go to over at Lowell when we wrap up. So that's a little bit about myself.
Thank you so much. Stephanie?
I had this like anxiety about whether I would forget to unmute, but I remembered. So I just wanted to share a little bit because I came to the academic setting from many years of clinical practice. And what seems relevant to this discussion now is that, so I graduated from nursing school the year of the first AIDS case and worked in the AIDS and HIV field in the sort of beginning of my career, I guess, setting up programs and providing direct care. And even as we talk more, it's seeming like it has so many parallels to what we're dealing with now. And that and it seems relevant to what we are going through now. And as I look back, it was a time that we changed healthcare. We changed how care is provided. And it actually gave me hope that we can use this time to make some big changes. I do have a horse and a dog and two pretty grown-up children, 24 and 26. I don't know if they ever grow up, but I guess that's what I wanted to share. Thanks. And it was really great. Thanks for your nice introduction, and that this panel is an amazing, I mean, I'm grateful to be presenting with you. So thank you.
Yeah, I feel very honored to moderate you three phenomenal humans. So now we can start our questions. So as I think it was shared in the email to everyone here today, but we have 2 questions, and we plan to take questions and comments after the panel, but of course, use the chat away. Just don't dominate in that narcissistic way that Mickey was talking about, right? But Susan Kong will collect, and then she'll share those with us at the end. And so we're going to start off with our first question, which is our question for the panelists to, spend some time with. We did our time calculations, and it's like 6 to 8 minutes per question. But personally, let's make this conversational. So feel free to sort of talk through this with each other. And this question is, tell us about the main challenges that you have been addressing in community health and wellness work this year. So again, whoever would like to start, please unmute and go for it.
I unmuted, so I guess I have to start. Sorry. So I'm coming to this from also a nursing perspective. And I think one of the main challenges to, I guess, my community and our community is our caregiver stress and burnout, that we're kind of falling apart. Caregivers, nurses, physicians, healthcare providers. Another challenge is that there's just not enough resources, both physical resources and mental health resources. I think a concern that we talked about, and that I think maybe we could, that maybe Julie's addressing in some of her work, is really fragmented care. People come in for crisis, and people come in for physical care and then later have a mental health crisis, but it's not integrated. And that to me is so frustrating, because I've been wanting that to happen for many, many, many years. What we're seeing in students is there's not time for wellness. Like, so I've started doing really brief things, like take a deep breath when you open a door, because they said, don't tell us to take a yoga class. We don't sleep enough. And then there's the problem of access in some really underserved communities, because they don't have computers and cell phones even. And I think we're missing them. I mean, my thought is that they may come in for sort of crisis medical care, and that might be a place to reach people. And then I think that the last part of my comments, I think Alvin kind of addressed, but it's a time of really tremendous uncertainty. It's like, and I was thinking, remember when this is 3 months? Remember when we thought, and this is it's like we have to reevaluate all the time. And I've gotten to where, like, I don't know if I believe what we think is going to happen now. So it's dealing with a lot of change and uncertainty. And then I think added, and I think some of us have addressed this, my dad died in a nursing home during the epidemic when nobody was allowed to see him. So a lot of us are dealing with loss and grief. I mean, I don't know many people who haven't been touched. So I think those are some of the main challenges, and I'll just invite my colleagues to talk.
Thank you so much, Stephanie. So Julie or Ruby?
Would you like me to go, Ruby? Okay. I just want to say a couple things first off. This was an incredibly hard task for me to sit down, think about my work, and think about its impact. How does my work with my colleagues actually make an impact on community health and wellness? It's one of those academic existential questions that I avoid, although I shouldn't. And to really, really think about, what am I doing? Does it make an impact? And if so, how? And so, one, it was a stressful experience, but a very fruitful experience. And so maybe you all do that all the time, but it was really an important task to really think about, does anything I'm doing make a difference? And so thank you for forcing me to do that. And I also just want to take a shout out. This project I want to talk about is a collaboration through and through. This is a project I'm working with Dr. Tiffany O'Shaughnessy. I don't know if she may be dropping in. She's super busy. She's associate professor in the Department of Counseling. She's a fabulous partner. Dr. Molly Streer, another fabulous partner in the Department of Counseling. And I also want to make a shout out to the chair of our department, Dr. Toporek, who has been supportive of this project. And I actually think invited me to be on that. And I remember thinking, why? What do I have to offer? But thank you for inviting me. But what I'd like to talk about today is a project that we're working on. And I think Gretchen mentioned it, and maybe some of you get my flyers. I send them out all the time. This is our project, a nice long title, the Equity and Justice Focused Integrated Behavioral Health Counseling Training Project. So I'm not going to say that over and over again, but I would like to talk about it because I think it is aligned with community health and wellness, and it is addressing challenges to community health and wellness. And just to give you sort of big picture challenges that I see this project addressing, and I'm sure these are not new or novel to all of you, but number one, we have a mental health crisis among our youth, plain and simple. And just to give you striking statistics, if you don't know it, 104% increase in suicide, suicidality, and self-injury are among our youth age 1 to 17. Suicide is the second leading cause of our college students and among our pre-adolescents and adolescents. It's a problem. Second crisis, so we have a mental health crisis in our youth and probably in our adults, but it's really striking in our youth. The second crisis is an access crisis. So our youth, particularly our youth from low-income communities, our communities of color, our communities from historically marginalized communities, are not getting access. I know that's like not shocking, but just to give you a sort of local picture of that, the place in which our communities, our underserved communities, go to get mental health services are our community health centers, and there's a 4 to 6 month wait list. So there are kids waiting months and months and months to get community mental health services. And I will just add, and I'm not trying to put salt in the wound, and I am going to talk about happier things, hopefully, but we're 39th in the states on access to childhood health care. It's troubling. And I think when you think about our kids in the state of California, I think there's something like 9 million kids on Medi-Cal. And of those 9 million, maybe 3% get mental health care. So it's pretty significant. It's a big problem. So we have a mental health crisis, we have an access crisis, and then we have a workforce crisis. So the workforce crisis is we just don't have enough behavioral health. And I'm using the term behavioral health. It's synonymous with mental health. If I switch back and forth, I'm just still riding the horse of which one I prefer. But any event, we have a workforce crisis. We do not have enough behavioral health providers to respond to this demand. And I think I read somewhere recently that maybe we're at 30 to 40% in terms of reaching this demand. But California has really said very explicitly, this is a pressing issue. If we don't address this, we are in trouble, and of which we are. All three of these things intersect, right? To really contribute to harmful outcomes. And then again, adding salt to the wound, these intersecting factors are surrounded by, I like to think of this visual of these three problems with a circle around it that represents our healthcare system, which unfortunately is built upon white supremacy principles. It's grounded in a payer and income system that's based on capitalism. It has done harm and injustice and trauma over the years. Yes, there are glimmers of hope and glimmers of transformation, but nonetheless, we are still existing in that structure, which has been very harmful to our communities of color and our other communities, our immigrant communities, our farm working communities, our trans and queer communities. So these things are intersecting and causing problems. So I like to think that this project that I'm going to talk about is at least directly, indirectly helping that, or at least addressing some of those challenges. And so this project, and I'm just going to say up front, this is a grant funded project. It's 4 years. We would not be able to do the work we need to do to move this along if we didn't have the funds. And I'm grateful for that. But I'm also sort of like, why do we have to get all the grants to do this work? And by that, I mean, in order to get out there and work with our policymakers, our advocates, our community providers to do that work, we have to have time, money, and resources. We have to be able to fund our community providers. They're hanging on by a thread. So it's always thrilling to get funding. And it's always sort of like, I wish we would have had the leverage and ability to do this irrespective, because as many of you know, going after grant funding is it's a whole ball of wax in and of itself. But nonetheless, that is driving this, and it's giving us that support to do this project. So maybe some of you are familiar with workforce grants, but this particular grant is really designed to address the workforce shortage, which in a sense impacts access, which in a sense impacts mental health of our communities. And so one of the ways that we're looking at this is, wow, our community health centers. And I don't know how many of you are familiar with community health centers. Maybe you are. They're also known as federally qualified health centers. These are community health centers that are designated by the federal government and charged with serving the most underserved communities, those that wouldn't otherwise get care, our low income, our farm workers, our immigrants, those communities that need care. And the other lovely thing about our community health centers is that they're all aspiring to or actually functioning in an integrated care way. And yes, we can debate the quality of integrated care. It's not, there's iterations of it, but generally speaking, we know that our communities, when they walk into primary care and they have to go across town for mental health care, it's not going to happen. Right? It doesn't even happen for many of us. And so these are centers that offer dentistry, vision, OT, PT, mental health care, and behavioral mental health and healthcare, right? All in one-stop shopping, sort of like, and they are in theory or aspiring to be very culturally humble, aligned with the needs of their communities, situated in their communities, and many of them have leaders in their institutions of the very people who need the services. And so they are trying to enact some of, certainly some of what I'm sort of in love with the disability justice principles, of where we need to be led by the very people impacted, right? We need that sense of interdependence. And so, they're not all running perfectly, but the intention around these is really a great thing. So our students, who are a terrific mental health workforce, our students work all over the place in communities, colleges, educational centers. Some of our students go on and get their LMFT, some go on and get their LPCC, these are counselor licensed, some work in schools, some in colleges. But we are a counselor training program, and we produce, we graduate maybe 40, 50, 60, Rebecca, if I'm off, let me know, a year. They're not going in these community health centers. And they're also not working in many of these integrated school-based wellness centers, which are also a very important space where our kids are getting integrated care, walking in, getting sexual health, getting their teeth cleaned, getting OT, PT, getting outreach, right? These centers have a quality that is very much aligned with, the holistic way of thinking about health and well-being. And so one of our primary aims is to get our students to increase the workforce, but also to get our students in there. So we're trying to develop a pipeline, and we're working with our community centers and trying to get our students in there for internships and also to get employed. What does this take? And I think this is like the piece around having the grant leverage and support. There's structural things we have to do, but the work around being able to have a community health center or FQHC have the resources and time to take in a student is a super big challenge. I feel for them. On top of it, it's COVID. On top of it's everything. And so here we're knocking at the doors. And these are agencies like La Clinica, Native American Health Center, San Francisco Community Health Center, Mission Neighborhood Health, maybe some Daly City Health Center. Maybe some of you have heard of these or go to them. Taking on a student, even though they are so low resourced and staff, is a challenge. So we're trying all kinds of creative ways to collaborate, to work collectively. Everything from us providing them some funds for supervision, to us providing them trainings. And so there's a whole number of things that go on there just to get in those sites. But our goal is to really become part of this workforce, because our students, I know I sound like a salesperson for our student body, so forgive me, but our students they're from our communities. They are multilingual. They reflect the very communities that we serve. And historically in these settings, for professional identity reasons, for licensure reasons, there's just been territorial things that get in the way, but we're making headway. So that's a big piece of what we're doing, is trying to get into those settings and develop that pipeline. I want to make sure I'm not really going over time. Am I okay?
You're good. I think you've
Okay.
shared so much about the challenges in the community. It sounds like the trainers are exhausted, and then we're,
Oh yeah. I mean, and I think when we talk about just health and wellness, and there's so many layers to this, sort of like health and wellness of our community providers who are hanging on by a thread. And we're saying, can we come in and help? And then our students who are hanging on by a thread. And, I have to chime in, our faculty are hanging on by a thread, so it is hard. But I will say one of the most rewarding aspects of this project, at least for me, is the collaborations with my colleagues. And maybe other people do this all the time, but it has just been the most joyous and meaningful experience for me to collaborate with my colleagues and do something that feels so satisfying, in the sense of, this isn't a research grant, it's not, this is something that we're actually in the communities. We're talking to policymakers and advocates, and it feels, it is, selfishly, it feels like we're doing something real. I'm not just saying research isn't, but it feels like we're making a difference in that real way. And so that's a piece of it. And there's other pieces of this grant. One of the things we're doing, and probably all of you get my flyers that I send out all the time, that we're offering these trainings on integrated behavioral health. And one of the things that we hope to bring, there's integrated behavioral health, and there's all kinds of training, warm handoff, interprofessional learning, team-based care. But I think one of the things that we hope to bring is, let's look at integrated behavioral health through a critically conscious lens. Let's look at it through a justice lens. And, these are hard. What does that mean? What does it look like? We throw these terms around, but we're sorry, did someone?
Oh, I was just going to say, I feel like that really aligns well with what Ruby's doing in the community too.
Yeah.
So similarities, we have like Stephanie mentioning the workforce is really stressed. And then you're talking about, you're kind of this in between both of what they're doing, where she's talking about within the classroom, you're out there training. And then we have Ruby, who can maybe share right now some of the challenges she's experiencing out in the community, picking up on what you were sharing, Julie.
Yeah, absolutely. Ruby, do you want to?
I'm unmuting now. So before I kind of talk about the challenges, I also just want to acknowledge that the last 2 years have been very hard and difficult on all of us. And I didn't want to type in the chat because I also wanted to listen to what Julie was saying, but I also wanted to acknowledge what Stephanie shared about her parents. So I give you big, big hugs and loves regarding your father. So I'm so excited to talk about this community work that I've been doing. I really feel like it's a collective effort and initiative that is of, by, and for the Filipino community. So I'm going to talk a little bit about the community itself so you all kind of have some background and context. So this project really centers the Filipinx residents in San Francisco, specifically in District 6, which spans the Tenderloin and South of Market neighborhoods, as well as the Excelsior of District 11. And I believe my poster from the Society of Public Health Education Conference is on the CHSS website, so folks can look at that if they want. But it is a poster about this project. For those of you who don't work specifically with the Filipinx community, I feel like some of the lessons learned, some of the practices that I talk about could definitely apply to other communities, particularly groups that have been marginalized and minoritized. So I was actually asked by a longtime friend and activist in the Filipino community to work on a project focusing on the health of Filipinos. And my friend happens to be the director of the South of Market Community Action Network, and Gretchen mentioned that. They are a community-based organization that lifts up the voices of immigrants, people of color, low-income communities, so that their voices are heard by government to inform city policies and practices. So why is it important to focus on Filipinos? And I'm going to say, why not? Right? But I will say that Filipino Americans are one of the fastest growing Asian American groups in the United States, the second largest Asian ethnic group in San Francisco, and Filipinos make up the third largest monolingual or limited English proficient group in San Francisco, right? So Tagalog is actually the third language in San Francisco that requires translation for all city affairs. And as I've learned that Filipinos are not widely represented in public health studies, the research that is available shows that Filipino Americans are disproportionately impacted by chronic diseases. And as we know, underlying health conditions such as chronic diseases can worsen COVID-19 outcomes. So it's really important that we address this. So I told the director, let's go for it. After some brainstorming and writing, we were awarded a $500,000 3-year grant beginning in 2019 to address chronic diseases. So shout out to the San Francisco Public Health Foundation's Sugary Drinks Distributors Tax Initiative, which is also the soda tax, also known as the soda tax, that supports this work. And I have to shout out to myself for getting this grant for this organization. One of my colleagues in this space told me that women and women of color don't always publicly talk about how we excel. So I'm going to just talk about how proud I was to get this grant. And now I'm not going to talk about myself anymore. So community health ambassadors actually play a pivotal role in this project. So multi-generational and multilingual residents were recruited and trained to conduct a community assessment, develop culturally and linguistically relevant educational materials on health and wellness with an emphasis on chronic diseases. And they also conducted outreach to promote our health education workshops and physical activity classes. And in this final year of the grant, the community health ambassadors are actually using the assessment findings to guide their policy advocacy work. And right now they're going through like a political education training. So our biggest challenges, the pandemic happening, right? We started our work in January 2020, and 2 months later, everyone's life was completely disrupted. The foundation said to us, please continue the work and have it be online, have it be virtual. And as we learned in the last few years, there are gaps, there are inequities when it comes to technology access and literacy. Many of our community health ambassadors did not have computers. They didn't have reliable Wi-Fi. Some of them never used Zoom or things like Google Docs before. So there was a really huge learning curve. And that meant we had to meet folks where they were at, right? So pulling together the resources and people power to get tablets out to folks, walking them through all the steps of how to use Zoom, right? Or Google Docs, right? Doing this all through the phone. And at the same time, being kind, being gentle, and really just being patient and flexible. The other big challenge I wanted to mention is how the pandemic impacted the larger community. Folks who worked in service lost their jobs, their incomes. Some were faced with the threat of eviction. Some of our seniors, because they're, fear of going out, were isolated, socially isolated, and families were cramped at home supervising distance learning. And that's not unique to the Filipino community. We're all experiencing that. But at the same time, I would say this is a very vulnerable group, right? Low income, community of color. Some of the folks that I know, there could be 4 or 5 multi-generational family members living in like a one-room space, right? Just to give you an idea. So at the time, it seemed really inappropriate to focus on chronic diseases with all the economic and mental health crises going on. And as Gretchen mentioned, we pivoted, and really much of 2020 was spent on working with all the different local organizations in the neighborhood. So I think of Bayanihan Community Center, Bayanihan Equity Center, I think of the West Bay Filipino Services, I think of United Playas, all these other groups, right? We kind of came together and said, what we need to take care of the community right now. And so we came together collectively to provide and distribute basic needs and PPE to the community, right? Especially to our seniors who are more at risk of hospitalizations and death. And this was before the vaccines, right? As we eventually adapted and shifted to online programs, the health education workshops that we had, they weren't about chronic diseases. They were about COVID. They were about vaccines, where to get vaccines, are vaccines safe, right? They were also about mental health, because many of us were experiencing sadness and depression with all the loss and trauma going on. And so just to reiterate, our biggest challenges were pivoting from our work plan where we had goals, objectives, timelines, categorical funding, right? Pivoting from that to just meeting the needs of the community. So I'll just wrap up with that.
Thank you for that. I feel like the pivot, it sounds easy, pivot, move, but it's not. We have so many things tied up in what we're supposed to do, what we think people are expecting of us, funders. I love that they're like, keep doing it, just keep going. And Julie was mentioning that as well. It's like, oh, we have this money, we should be so happy. But actually, it's not the money, it's just we need some sort of driving force, to help us, and that's financial. So all of these things come together. It sounds like there's a lot of similarities in the challenges that you all have had addressing the community. And wellness, and it's also trickling back into your classroom. So, do you guys have anything else that you'd like to add, like building upon each other's comments, or anything else you'd like to share regarding challenges? Ruby, would you like to say something? I saw a breath happen.
I thought I saw Stephanie unmute for a sec.
I am really challenged today, but I will talk. I just, we were all talking, I was just thinking, honestly, here, we should all be working together more. I know placements for mental health. We worked at, when I started at San Francisco State, I took a clinical group for their psych rotation at a shelter, because people decided, and really, it was a psych rotation, but nobody would come. It was like, oh, why don't you come to a group? And they didn't. So what, we opened a little clinic, and we put Band-Aids on, and we did dressings, and then all of a sudden our groups were filling up. And I think what both Ruby and Julie were saying, when it's really basic, when you can't walk because your foot hurts, you don't really want to go to a stress management group run by nursing students. but that was a way to connect. And I was also going to talk about the suicide in children, which is a huge problem. And where do they go to get care? They go to their pediatrician appointments. So I have a graduate student working on brief, and everything has to be really fast, a brief suicide assessment in pediatric clinics, and what they were doing was depression assessments that didn't assess suicide really. So it feels like, it feels like we could be working together. We could, this is a really amazing group of people in this whole community in, the College of Health and Social Sciences. And I would, I think that is one, I don't know, are we going to do the next part of our suggestions or challenges, or what was it?
Yeah, the next question, we can transition into that,
Do it.
but I was just thinking, you saying the collaboration, that is a challenge. It seems like we have our community challenges, but what you were just saying, how do we help our faculty and students understand collaboration? Like, how do we help each other? How do we connect through the communities? Because you've got knowledge, Julie has knowledge, Ruby has knowledge, we all have knowledge. But personally, I find I'm like, collaboration, I'm like, they're just down the hall, that's too far. Like, I can't get down there, And so I think that's a really interesting thing to bring up, is that community health and wellness, but also the collaboration part.
I don't know if people in the group, but how do we know what everybody's doing? I didn't know all this. I don't know if there are ways that I'm not connecting with, but that would be great to know.
Yeah, I wanted to add just, I think this is related, that what makes, say, integrated care work is interprofessionals working together and sharing their language and understanding each other. Even when you look at the language of counselors versus social work, which functionally they're very similar, but even their language is different. Nursing and social work and counselors, right? And so just, I have a high aspiration to incorporate into this project some way in which we can bring together students from different disciplines to learn from each other, right? What does this mean for you, and how would you describe it? What does this mean? Because I think there are territorial issues in terms of professional identity and how people work together. And it seems like in our college, we have social work, nursing, counseling, health vet. We have like this rich group of disciplines who, in terms of providing integrated care, there's got to be a way to train together, so I'm not sure if that's totally aligned with what you were saying. But this is a separate thing I just wanted to add when you were talking about screening adolescents. This is a new piece of information, and it's more of a happy note, I think, is that one of the things that's just passed in San Francisco is, the way in which kids and adults get mental health care is they have to have a diagnosis based on our medical model, right? The DSM. What's changed is that kids who score a certain way on the ACE or have any trauma history can now get behavioral health care, which very good news. We're addressing social determinants of health. The bad news is we don't have the people to provide the service. But I just wanted to kind of highlight some of the small transformations that are taking place. And there are lots of efforts to say, how do we incorporate social determinants of health into our work with our kids? And how do we change this very harmful payment system that keeps people out? Sorry if that's left field.
No, I think it's a good reminder of, we need people. We need more people to come out. What did Stephanie share with me last week? The amount of applicants for spots in your program. I know public health is a highly coveted program, as is counseling and nutrition. And so we have interested students, but we don't have enough people to train them. And then we have these facilities that need these professionals. So there's structural barriers here.
Oh, can I just add to that one?
Yeah.
I just need to say that when we think about workforce issues, there are such upstream issues. It's not just that we can't get our students out into the field. We can't bring in many students. I know there's some administrators here, so of course I'm speaking to you, but listen, we have 500 applicants, 400 or something to our program. For our program, clinical mental health, we had 150 applicants. We could bring in 10, you know? So I don't know how that's a pipeline barrier, you know, in terms of how do we bring in more people to do this work? I just had to get that in.
I'll jump in real quick. So just thinking about Stephanie's question in terms of like learning about what our colleagues are doing, what other folks are doing in the college. I think just even seeing the posters on the CHSS website was really inspiring for me to see what other folks are doing. So I think opportunities like this are key. And this kind of moves towards one of the suggestions that I have, but also like being able to have relationships with folks outside of our own departments, right? So some kind of opportunity. And maybe that's something as simple as leaving your door open. And when I walk by, I'm going to say hi. And thinking about Mina Roberts, who worked in RPT, we actually got really close from talking in the elevator through other people through shared relationships, right? We started talking in the elevator, and then she pulled me onto a research project when she found out that I work in public health. So just making those connections with each other. I feel like the system makes us gives us so much work to do that we don't prioritize like connecting with people. And I think it's important to pause for just a sec and be able to do that.
Yeah, I agree. And I think that's the perfect transition for you guys to share more of your suggestions. So our second question is, what suggestions do you have for other College of Health and Social Science members who are engaged in or want to start community health and wellness work, as well as what we've been talking about, you know, on campus collaborations? So we can start with you, Julie. You can start alphabetically again.
Well, I might not have gotten to this question, but I'll fly by the seat of my pants here. Well, I feel like, and this is nothing profound or novel, but we got to go into our communities and see what they need. You know, I mean, I am guilty, as hopefully some of you, of working in a bubble and not getting out there and realizing the work I'm working so hard on isn't really that important, you know? And I'll say one of the things that's come out of this workforce grant is now I'm working with a community provider who wants to figure out if their family-based curriculum works. They don't write grants, but I'm happy to, and I get to do something with them, you know, it's meaningful for them. And so I feel like, you know, some of us are more extroverted and comfortable going out there and getting involved with the community. It's a harder one for me, but I think if I don't keep in touch with my communities that we're working with, for example, advisory boards that come and go, or consortium meetings about particular problems or issues, where we can, you know, work collaboratively. I was just working with these two people who do policy and advocacy around behavioral health. And, you know, I hear this a lot when I'm in these spaces is, where are the academic institutions and how do they fit in here? You know, and what is our role there? And so I feel like, at least at this point in my career, that's a priority. I have to get in those spaces to figure out what really is needed and how I can use my skills to support what they're doing. I could do the background stuff maybe to help them do, because they are out on the front lines doing the hard work and don't have the resources and money. Not that I have tons of time, but I think that's an important one. So those are a few thoughts.
Yeah, thank you. I think that's important. Ruby or Stephanie?
Yeah, I can jump in. Again, it's not rocket science, but it's a nice reminder to remember that communities are not homogenous, right? Especially if we're working with community, right? We all have different backgrounds, we have different stories, and just because I'm Filipino doesn't mean that my thoughts or my views or my experiences represent the entire Filipino community, right? And likewise, just because I identify as Filipino doesn't make me an insider of the community, right? It doesn't automatically make me an insider. And that kind of brings me to my other point of recognizing our positionality, right? So this critical self-reflexivity, which I think is part of cultural humility, even with people of my own culture. So I think about like my education. I have 2 college degrees. I'm hopefully going to get a 3rd one this year. I think about where I was born. I have a blue passport at home. English is my first language. So for me, as someone who works in higher education, I need to recognize that and critically reflect on how I connect, how I show up, and how I work alongside folks, right? Really thinking about all of the power dynamics at play. Yeah, and I just wanted to kind of reiterate again, the relationships, right? We have these work plans, we have these timelines, we have these objectives, but really at the end of the day, and this is something that many of us have learned in the last 2 years, that the people around us, our communities, our families, that's really what's important, right? I do have an objective that by 2022 of June, 3,000 Filipinos will have been reached, right? But again, I'm going to pause for a second and remember and ground that my work is in this deeper vision of connecting with others, right? Building community, seeing the humanity in one another, especially during these uncertain times. And just ending on embodying what we call kapwa and bayanihan spirit, and remembering that we're all interconnected.
Thank you. That was beautiful. Stephanie, do you have any advice for those interested in community work and engaging?
Yeah, I mean, yes, I have advice, although probably not good to give people advice, but I think what I'm realizing with this process, and as we talk here, how important relationships are, and hallways work for some people, not, but the School of Nursing is its own place. I think that it needs to be more formal. It's kind of isolated. I don't go past other halls. So I don't know the answer, but I would like to think of ways to facilitate this. I think that also what Ruby was saying about, if we're going to keep doing this care, we have to take care of ourselves. And I think that has become very, very clear. So Elaine, I see you there. You're one of the few people that's showing up, because we did a little project. We did a brief stress management intervention. We taught students things that took like a minute or 2. And then evaluated resilience and stress. Happened to have done it with a control group during COVID, when COVID started. And it helped. 100% of the students that took stress management said that they bounced back quickly, compared to 58% of the comparison group. So I didn't know that little things would help. So we taught things like brief meditation, like just close your eyes and remember where you were on your best vacation. And you could do that now just for 15 seconds. Take a deep breath when you walk into a door. We did, and I think this is my favorite, and it was helpful with patients, is just go in the door and breathe in compassion for yourself and exhale compassion for everybody else. So those are my little, my little tips. But I think we have to manage our stress. We can't keep working like this. The other couple of things is that I don't think we've talked as much about advocacy as I thought we would, and as a role for our community, for the San Francisco State community. And I was talking with the physician that I worked with when we started the AIDS program at Kaiser, and it was like a real multidisciplinary clinic with health education and social workers and nurses and doctors, and also patients represented. And it was really, really great. But we were saying, and some of you won't remember this, but we were saying we could have never done it if it hadn't been for ACT UP out there doing active, I was at Kaiser and they had staged a mock funeral outside of Kaiser, but it was like, that's got me hired, that got our clinic started. And I think there are opportunities for that. And I would just like to kind of end saying that I think we're pretty uniquely positioned here in this college to offer some solutions, to work together. In my ideal world, we'd all be working together to improve the health of our communities. So I think that I will end with that.
Thank you for that. I feel like we had some really important points. Getting in the community, communities are not homogenous, cultural humility, relationship building, taking care of ourselves, advocacy. And on that note, I would love to open up to the audience questions. So as usual, we have a process, right? And we're familiar with this, but just you can either raise your digital hand and we can call on you, or you can type your question into the chat. And remember, this is a safe and open environment of inquiry. And then panelists, you can raise your hand also, so we know that you want to answer that question. That'll help us a little bit. Or you could unmute and just jump right in. So questions from the audience to Julie and Ruby and Stephanie. I see Rick's hand.
Hey, y'all. Thank you for being here. It's marvelous. It's incredible. And I always take away from these showcases and these times together some little nuggets of knowledge, something that was a good reminder. And I'm curious whether there was anything either putting together your ideas or listening in that you learned that was a good reminder, or something that you might have learned that you didn't already know. And that's an open-ended question. I just like to collect these little nuggets. So.
Rick, will
That's an
you
open
say
to
that one more
everybody.
time? Will you say that one more time?
Yeah, what did you learn that you didn't already know? What did you remind yourself about? Because we all remember to breathe, but then we forget to breathe. So how do we implement what we already know in a way? How do we remind ourselves, or did we learn new things about ourselves or about the process of sharing with colleagues in a peer-to-peer situation? There's a number of open-ended elements there, but what do you go away with from the time that we've spent together?
Like Ruby, I see your hand, Ruby.
I appreciated the reminder from Stephanie about self-care, right? And thinking about Rick's question, I think about listening to yourself, listening to your body, listening to your heart. And Marty and I had a nice little check-in in the hallway this morning, and I let her know that yesterday morning I woke up with pain in my hands and my wrists, right? And my shoulders. And it's because of this computer work for the last 2 years, right? It's like triple time of the computer work. And so I told myself yesterday, I said, this is not good. I don't want to end up with surgery in my hands. So I had to listen to that. And I had to allow myself to pause and take a break, right? And move my body, get out there, run, do some yoga at home. And tell that voice in the back of my head, it's okay that you have this list of things that you should be doing. What's important is listening to what your body is telling you in the moment.
That was powerful, definitely. We're definitely taught to not listen to ourselves. So I think that's a really good reminder. How about Stephanie or Julie?
I think that what I learned is I'm really amazed and honored to be working with people like this panel and these people that are here. And I feel like I was getting pretty isolated in my little, well, I'm really isolated now, but so I am and it makes me feel proud to work here. So I admire the people on this panel and I'm grateful.
Yeah, I mean, I feel, I don't know in a better way to say it, but it is a really lovely feeling of connection that I will full-heartedly admit I work under a rock a lot. This just feels so nourishing to be around people and to share what we're doing and just belong and be heard and hear great ideas. And I feel a sense of I want to collaborate more with my colleagues and do it. Like it's possible. And so I just appreciate it. I can't remember who brought it up. I think Ruby, you were talking about walking by someone's office or being, I can't remember, but just sort of that happenstance stuff is so important. And I feel like that's even the way when working in the community, it's those happenstance conversations that are like, wow, that is burgeoning into something so meaningful that if I stick to my sort of rigid way of working, I never would have happened onto that. So just feels very nourishing here.
Yeah, that was a great question, Rick. I hope we can have more of that. I know we're hoping to be on campus in the fall, but day by day, right? Day by day. Marty, I see your hand. Do you want to ask a question?
Clicking all the unclicks. Hi, everyone, and thank you to Ruby and Stephanie and Julie and Gretchen for facilitating this. I think one of the things that strikes me about community, it harkens back to a piece I read a long time ago that really names something that resonated with me, which, being in community health and thinking about community health in all of these different ways. It does sort of bring up the question, what is community? And for me, and the way I sort of think about it is that in part is that it's a practice. It's not an outcome. It's not a stagnant thing. It's not a separate thing. That it's a practice. And, of course, we all have overlapping communities. We have distinct communities. We have, but they're all living, breathing, changing dynamic entities. And so as we think about what community work is, it really does come down to how we engage in our lives with each other, with ourselves, what we prioritize in any given moment so that we are engaging in that practice with as much integrity and authenticity and sort of I guess honesty, so that the community that we are building is one that is, for lack of a better word, but I can say it in this group because I think you understand the breadth of what it means, healthy, enriching, something that allows us to thrive. So I was thinking, the idea of self-care always strikes me because, of course, it is absolutely important and absolutely essential. And yet, as we know, all things happen in a context. And so I think early on, Alvin was introducing today in thinking about community healing. We are desperately in need of community healing on this campus. I will give a shout out to our new provost, who I think is is going to be a really play an important role in modeling what leadership that has an eye on healing and care may look like. I also want to give a shout out to our dean, Alvin, who I feel like you have risen to a place in your leadership over the last 2 years, especially, and responded to what we're living in these really unprecedented times, uncertain, difficult times, in a way that has allowed many of us to shift. I mean, we can shift independently, and we can fight against things as much as we want, but it's a lot easier when we actually get to work with. What happened with the chairs, with the story that Alvin described earlier, was we did something collectively. It took one person to say, not only did she say stop when we were doing the Hood nomination that Alvin talked about earlier, not only did she say stop, but she said, this hurts. This is uncomfortable. This hurts. And then what happened was more people shared the way it hurt. Why are we trying to select somebody who best pulled themselves up by their own bootstraps against all odds? Why are we trying to pick which nominee, all of whom were students of color, many of whom were women of color, many of whom were queer women of color, which one pulled themselves up by their own bootstrap the best? It felt sickening. Many of us felt it. I won't say we all, I don't know. Many of us felt it, but because that was the system that always does, and oh, this is what we do, and this is that part, we were kind of continuing to do it. But because the pandemic, I think, has slowed us down, and because, Alvin, you have modeled leadership that has allowed us to stop things in a different way, we listened to that, and we engaged in a practice of community that allowed us to push back. So I'm curious, I guess I do have a question in here about where we are as a campus community. We're all used to doing this. What do we do? What do we need to make sure I'm afraid we're going to come back in person and what's that, the rubber band thing, where you stretch, but then when you have the moment, it just snaps back to where it was. How will we remember what we need? How will we remember that we need to intentionally engage in the practice of community in particular ways, so that the community we rebuild is one that allows people to thrive on campus, and not just the same people who thrive on campus, but actually allows us to change things in a way that lifts, and I will use that E word, that equity term, that particularly lifts the people who have not been lifted before. That's my question. Thoughts?
Yeah. Maybe Stephanie? Julie?
Honestly, that is my question. I don't know. I mean, I was thinking that, like, how do we do this now?
I'm going to take a risk and say, I do think we need to look at our RTP structure. I just do. It's old and white and staunchy, and the buckets. I hate the buckets. I'm not saying that the substance of the buckets, but it feels, and maybe it's because I've been on UTPC lately and I'm thinking more about it, and just, I had no idea what it would look like, but it just feels like that would be a place to start with faculty, is how do we think about our workload in a more sustainable way? And maybe it doesn't have anything to do with the way we structure it with buckets, but I do think we need to think about it.
You are not alone in that thinking, Julie. Um, Ruby, do you want to add anything to?
I just wanted to say that was so deep, Marnie. Right? How can we create without reproducing these systems of white supremacy culture, right? Global capitalism, right? Where we're like moving, and producing, and forgetting again what is important. And I think about my own teaching practice because I've shifted a lot, right? In the last 2 years, I feel like when I first started as a lecturer, I was like super strict, like had my red pen. This is a blue pen, but I had my red pen. I was like writing all over everyone's papers. And I'm rethinking that. Like, what is the purpose of that? Is my purpose to help folks grow as a writer, to grow as a thinker? Well, how can I do that differently, right? Likewise, I used to be really strict in terms of like attendance and turning assignments like right on time, but like we are going through so much. I'm going through so much. Are we going to hold our students to that same standard? I think we want to have high standards, but what does high standards mean? Right? And again, what is the purpose that we have with our students, and how are we doing? How are we doing that?
I so appreciate that comment, Ruby. I just feel like there's got to be a way to rethink how our expectations in a way that's sustainable and equitable and still creates a very learning and nourishing environment. But I do think we often fall back to these very white oriented ways of teaching. I even think about writing, just what we expect around that. So I really appreciate that comment.
Everyone should take a look at the chat because Sharia just shared something that goes really well with what all you three said. A quote by Sonia Renee Taylor. And I think there's just a lot of revisiting. I mean, as Alvin said, like instead of fighting against, let's create, let's redefine. And that comes from the RTP point of view, from the student classroom. Even thinking of Shreya putting a comment in there, she may not remember saying this to me, but we were just talking about students' absences. And she's like, if someone's asking for an extension, they have the bravery to do it, whether their dog really died or not. Something's going on and they need space. So give it to them. And so I'm like you, Ruby, I've changed, I've evolved. That red pen, I don't have a red pen anymore. I got rid of it. And then I think that's really profound also.
If I could, Gretchen.
Mhm.
I love where this conversation is headed, because I think this whole time in this pandemic and the conversations like this have really forced us to stop, not just keep walking like what we always do, not just the same old, but to stop and think and see, is this the direction we need to walk in? Is this the path you want to create? And, the fact that nobody here may have an answer to any of those questions, I think is perfectly the place to begin, right? Because I think the first task is really for us to stop, just like Liz stopped us, just like we're all kind of disrupting the norm, right? And that's an opportunity. I also think, as I said earlier, that then both the hard and the fun part comes. It's like, okay, if you don't want to walk in this direction, what direction do you want to walk in? What's that path you want to build? How is it going to look differently? If you're not going to use a red pen, what are you going to use? And what are you going to say? How are you going to treat these absences, right? How are you going to do RTP? What does that look like, right? A couple of people are on here, and one of Mickey's gifts, and I will say more about this as this group comes through, is Mickey has been facilitating a group that we created to really look at RTP. And I remember when I met with them earlier this semester, I said to them, look, I want you to really rethink the RTP process. I want the RTP process to be a liberatory one. And they all looked at me like, I want the RTP process to be something that gives faculty agency and voice, right? Rather than having to fit in buckets. I want them to really have a place where their work can be honored, a place where they can have agency in the types of people they impact, the scholarship they have, right? Not this academic trying to be Berkeley or Stanford crap, right? But really giving and empowering our faculty to have the kinds of meaningful lives, right? Not high impact factors, but meaningful lives that we all want. How's that gonna look like? Hell if I know. I got no idea, you know? The faculty member from public health was looking at me like, oh, crap, you're really, oh, now you got me, right? And I looked at him, I said, you know, you public health folks are always talking about going, you know, structural determinants and going upstream and not just focusing on the downstream effect. I said, that's what I'm having you do. Go upstream to the RTP process, to the headwaters, see, you know, undo the assumptions, look at it closely. And I honestly don't know where this is going to head, but I will tell you, just as I tried to say earlier, this is where my hope lies. In spaces like this where people are struggling with, I don't know. And it's okay because we've never seen justice in the forms that we need it. It's up to us to create it. So, like I said, I don't know is a great place to start. That's when the fun begins.
I love that. That's where the fun begins. Thank you all. Do we have any more questions? I feel like that was such a fantastic end of the panel here, but anyone raise their hand or unmute if you have some final questions. All right, I don't see any hands. So surprisingly, we are right on schedule. Does that ever happen? I don't think so. Wow, we are creating it, you guys. So of course, I want to thank everyone in this space, especially our three panelists, Marty, Alvin, thank you all so much, and Mickey for being here, the developers of this, so Zubeda and Susan and blanking on the names, but anyone. I just wanted to say one last thing. I mean, we've summarized so much of what everyone has said. It's been fantastic, but in the process of everyone sharing, a community was created. And it sounds like we want that community to continue. And we want to find ways to connect and advocate. And so I hope that that happens. I'm confident that you guys will create that path, you know, with yourselves and within communities. So have a fantastic hot evening. I'm sweating right now. And I really appreciate everyone's time. So thank you so much.